All right. Hello, everybody. Welcome to Camellia Place. And I've brought some friends with me today. We are demonstrating our brand new software. Actually, it's more than just software. It's equipment and a whole lot of fun stuff. So this is the VirtuSense VSTBalance fall risk reduction technology that we're rolling out now at Camellia Place. This is assisted living and memory care in Woodstock, Georgia, and we're super excited to roll this out. This is something that we feel will really benefit our residents, the folks that live with us. If people want to come in off the street and hang out with our partners, our therapy partners, Rise Senior Living, they're more than welcome to. We encourage it. This is some really neat technology, so we're happy to demonstrate it today. We're going to walk through very briefly what this technology is, how we use it to our advantage. Again, we have Rise Senior Living on site every 5 days a week. They are our therapy partners, and so this really helps them do their job even easier. So. As a former coach myself, I know a coach's eye is valuable and it's well trained, and if you add technology to the mix, it's something that really helps. So stay tuned here. First, all right. So Billy Rhodes is also with Rise Senior Living. Billy, can you first give us a quick high-level overview of what we're looking at here and how it helps our partners?
Yeah, so this is just some great technology that really helps us to identify any risks of a fall over a 12-month period. These tests are very quick and easy to operate, easy to understand as well, and provides us with a lot of data that we can use with our comprehensive health and wellness assessment. And in conjunction with that, we can help a lot of our new residents who are moving into the community stay safe and happy, while also keeping all of our current residents up out of the hospital and just kind of maintaining their best life. I would say if you want to go through and demonstrate some of the tests, why don't we go ahead with that? And then
Sure. So we're doing the standing balance test where you have to get the patient, lights up in that green body up here, and then you give them the X, and then you press start. I think we've already gone through a couple of the tests before this live started, but we'll just go through this one. Eyes open on phone, and it just wants you to see, it's going to assess how stable this person is, and you'll see in a second here. For 30 seconds, they're going to hold their self in space, and this little target will indicate if I'm leaning. So if I lean really far to the left, you can see that. Or if I shift my weight back on my heels, it'll show that. If someone's really unsteady, it's going to look like this, back and forth. And it's recording all of this the whole time. And the more steady they are, it's going to sit right here in the middle. And so you can see if they favor one leg. Nice. And that saves the data.
Stand on the phone with your eyes closed.
All right, and the next test is the same thing. I'll just press start and show you again. So you do the same thing with their eyes closed, and you can see the difference between, okay, are they good with their eyes open? And so their eyes are doing a lot of the balancing. And if they do poorly on this with their eyes closed, that can give you some indication as to how good their sensory input is, or their vestibular input is. If their eyes are closed, you take the vision out of balance, and you'll see. Again, 30 seconds. If they're favoring one leg, that's what I'm saying. They'll be on one side.
Test completed. Press next to finish the test.
Next. On here, I can write, as a therapist, some comments on how they did. Say they opened their eyes or something. I can write that, or if they had any other adverse events. Can you see? Is this one on or no?
They're both on.
They're both on? Okay, well, you can see their score here. I think maybe Billy will go over this a little bit, but you can tell if they're kind of below average or below the median. You can see how far they're swayed or they're shifted to one side. And like I said, it'll give you that graph. And later I can print this out and maybe compare in the next few weeks after we've worked on their balance and see what this looks like, in a couple of weeks, see if we're making any improvement. There's another test or two. I think I'll just do the gait test. And this is looking at your walking speed, your step length. There we go. Let's see if I have it right back here. So you need them to stand
14 feet away. At the toe, walk briskly towards the sensor.
It's a little bit of a process. I need to highlight the resident. Can you move the... Nice, I got it. All right. And then I'm just walking towards the screen. Asking if we're using a device. You can use just the standard walker. There we go. Unlock.
Test completed. Press next to finish the test.
Okay. Once again, I can make some comments on it, and then it'll give me my gait speed, which is what we look at a lot for fall risk. Then we can also see step length, whether or not I took a really long distance step with my right versus my left. Also forward lean, if someone's really far on their toes but throughout the gait cycle, then you can kind of notice that. If they're below a certain range here, it'll give us a score of their high mobility or versus low mobility. And then we can use that as like fall predictors. And those are two of our assessments.
Well, if we can give, keep going through, and then can you give an example of something that one of our residents might be experiencing?
I need a chair for this one. So let me grab this chair. So say we have a resident who's coming back, or they're on respite, or they're coming out of rehab with a hip replacement or a hip fracture. And we want to
Please
see...
stand up and press the start button to calibrate height.
We want to see how well they can get up and down from a chair. And if they're favoring one leg too. Alright, so stand up. So you gotta get this, myself and the X here. Alright, gets your height, so you have the resident stand, gets their height.
Calibrated. Sit down in the chair with your arms crossed over your chest. At the toe, stand up and sit down 5 times as fast as you can.
Ideally, you would have their arms crossed, but for most of our residents here, they won't be able to do this, so you can do this with your arms on the armrest. So for say someone with a right hip replacement, likely they will probably be favoring their left leg. They're going to rely on their left leg more to do these sit to stand. So let's see if I can replicate this a little bit. Here, I'll do 5 times standing and sitting, and I'll try to replicate what it would look like for a total hip on the right side here. Let's recover. So I'm going to come to the left, up, 1, favor to the left, 2, 3. It lets you know at the top if you've made each rep. You can see here, 4, and 5. So
Test completed. Press next to finish the test.
we're giving a time, so ideally you want that time to be under 15 seconds. Then we'll also get some input. Let's see here. Low mobility, that's great. So you can see it'll catch that. They lean to the left, approximately 14 centimeters. You can see that on some of these reps. And you can see the time on each rep. So say someone is really, really weak or has poor endurance, they might have a decent time, like 4 seconds on the second and third rep, and then the fourth and the fifth rep could take a lot longer. You can see that. And then you can kind of compare that in 2 weeks from now. Okay, hey, we need to work on their endurance. They work on their endurance. Did these 2 times improve? That's the 5 times sit to stand. Gait. I can redo the gait one, maybe. Well, I'll do the tuck test. Give some variety. I clicked both of them, so we'll do both those tests back to back.
Away. At the toe, walk briskly towards the sensor.
Leave this out the way for now. Alright. Find the resident. Mark it here. Okay, so they're going to be favoring their left. They just had a right hip replacement. This is what it hopefully will look like. stand 14 feet. Nice. Okay. Start. Not using the device today. Start the short step. Yes.
Test completed. Press next to finish the test.
Next. Let's see if I get a good one. Come back to it. Time up and go.
Position the front of the chair at least 12 feet away from the sensor.
I use this almost with
Stand up,
everybody.
press the sensor, turn around and come back.
This combines them getting out of the chair, walking a short distance, and then getting back and sitting down. So you can see a lot just from this one short test here. So sit 12 feet from the sensor. Let's see here. Press start. Ask the resident to stand. Walk to the turn. And until you turn around, going back. And it stops the time when they sit down.
Test completed. Press next to finish.
Next. Okay, let's see. So this will show you my step length. Obviously, like the gait speeds are much lower. We're trying to get them to 1.16 for this person's age. So we can see we can make a goal for this to make 1.16 the gait speed. I pretty much had short steps, both left and the right, even though I was trying to make one a little bit longer than the other. But you can see a little bit of a difference. And that's for the gait speed. The timed up and go, which we haven't talked about already, but is it'll show you stride length, step length, compare the left between the right. It even gives us a difference here. And these are all things that I can kind of work towards, the equalizing, especially with, what I like about this is it has double support time. So how long they have both feet on the floor and make goals compared to this. And then at some point here on this report, they also have recommended exercises, which is kind of a neat tool, which we already kind of do, but based on my scores on the standing balance, it says he recommends this exercise, and I can put it in and add it into this client's home exercise program already. Like, okay, they did poorly on the 5 times sit to stand. Let's work on a couple of stretches that'll help improve their mobility to make that test a little bit easier. They have a whole list of them, and I can pick and choose the ones that I like, the best, and go from there. Let me put that test patient back up here. I don't know if they still want us to keep doing some more things, but that's all the assessments. That's pretty much most of the assessments. There's variations, like there's a sitting reach versus like a standing reach that we can do. And then there's some trainings. I don't know if they want us to get into that already, or if they're going to come back to it afterwards, but we can do a reach. No.
Well, Gunnar, can you hear me? Okay.
Yeah.
All right. Yeah, so I think at this point, maybe we bring in, let's see, let's bring in Billy again to talk about some of the scoring, and then if he needs you to demo anything, then
Sure.
So
Yeah,
Billy.
actually, Andy is phenomenal at this and does a lot of presentation on the scoring. So I thought it might be great to add him and have him kind of review it a little bit more.
Perfect. So everyone, this is Andy Champion from VirtuSense. So this is, obviously the manufacturer of the device that we're seeing today. So Andy, welcome. Thank you for joining us. The floor is yours.
Yeah, thanks guys for having me. And Gunnar, good work out there. I know it's hard when you are lacking a little bit of instructions out there and you don't hear any feedback from people. So that can be challenging as you're demonstrating. So let's first talk about I think the technology itself, which is that LiDAR system. A lot of people are a little curious in regards to what and how the system is actually tracking the body throughout these movements. If you've ever heard of any type of like echolocation or sono for the sonograms, those are all going to be reflections of sounds and sound waves. So if you've ever yelled in a canyon and heard your echo, that's an example of echo. It's really the same way that the system works. Instead of using sound waves, it's using light waves and actual radar and lasers. And so from that, the computer then, so it shoots out thousands of little impulses out each and every second. The computer then details how much, like what type of information is reflected back to the computer. It takes that into consideration, and then it can actually create a picture. It can create, it can actually describe objects. It can take a look at distance, gate speed. It can pick up speed of an object. And so instead of looking at ships, say in sonar or in the sea with sonar, we would be looking at the human body in this respect. And we would be looking to see how fast that individual is moving, step length, cadence, and the ability to balance, as Gunnar had demonstrated in the one activity. Now, the great thing about this is that we have actually done white studies and worked with several universities in regards to getting a significant amount of data that shows that our measurements are actually just as accurate as the $100,000 gate labs, 3D gate labs that you see in universities and so on and so forth. So it's extremely accurate with a fraction of the cost. When we look at the data in general, and I don't know if I can even share my screen. I might see if I can do that because this is always kind of, I don't know if it's going to let me do this. Can you guys see my screen here?
No, I can't.
No? Okay. There are, when we look at the data, and what we're really looking at is, you know, what does this mean from a clinical perspective? So as people are screening residents, the great people at Rise Therapy, what they're doing is they're looking to see if they fall below these norms. And this type of technology is capable of looking at the system, at the gate, the balance in a very objective, precise, and repeatable manner. And takes the objectivity or the subjectivity out of it from the clinician. So it really just creates data points that then the clinician has to report. So when we look at this, we can see people who are in this low, medium, or high fall risk. When we're in a high or medium fall risk, okay, that's going to put us at a much higher risk to potentially have a fall, have a catastrophic injury. I believe the injury rates when we do have falls is about every 15% of a fall will actually end in like a catastrophic fracture of some kind, which of course then, you know, puts people out of their everyday life activities, patterns, etc., that they want to do. If they're in a community, they want to continue to be a part of that community. And those falls are going to limit that opportunity, and it's going to downgrade them in through the health system, which is not what they want to do. They want to stay and age in place. That's the goal for all of this. And so when we're looking at this from a community standpoint, you know, what we try to push, and I think a lot of our clients and therapy clinics and facilities are doing this, is we're doing a lot of baseline screens so we can have an idea of where you are at that beginning time when you are at your healthiest, let's say. And then from there, we can actually track the amount of change that you're having throughout your life cycle, right? So if we do a screening every quarter or every 6 months or even every year, we can actually track to see what is going on with that individual and whether or not there's any trends that are good or bad. And if there are trends, you may even find that that individual is at a high mobility, but hey, we're actually not moving as quickly as what we used to move maybe 6 months ago. Maybe we're 10% slower than what we were. We're still high mobility, but maybe then we can have a conversation about that with you in terms of, hey, maybe you had, let's say maybe we're depressed. Maybe we're staying in bed a little bit longer than what we used to. Maybe we took out our walking program. Maybe we stopped being in the wellness program, those types of things. And then we can see how that impacts that person's life, introduce it back into that individual's life. That way they can get back into where they need to be. And then on the other side of that, when people are in that medium category and that low category for for mobility. We can get them the help that they need right away so that they're not having that type of injury. It's a way to be proactive versus reactive. If things are already going south or trending the wrong way, it's harder to get out of that specific valley, that specific regression, unless we can catch it quicker. And so I think that's one way that the technology is fantastic. As we look at a lot of that data, as Billy kind of asked me to look at here, we have things such as, the fall risk itself, which is really based a lot on the actual gait speed and age normative data. So how old you are based upon the gait speed, right? Gait speed in general is many times now considered like the sixth vital sign for the elderly. So we know that when people are slowing down, that they're just getting unhealthier. So our goal is to get them moving better, quicker, but not just in a, hey, move faster, but actually provide the foundation through therapy and wellness to stay healthy and move faster in an appropriate manner. And I'll give you a perfect example of this. When you look at the data that Gunnar was going through, it was, one of the things that we look at is, okay, let's look at step length, okay? There's an average step length there. When he was going through his actual assessment there, he pretended to have an issue on one of his sides of his legs, and he was taking shorter step lengths. Okay. Now, the idea is, okay, let's not just tell this person to move faster. The idea is to let's see what we can glean from this test and get a quicker result through therapy based upon the information that we're receiving from the test. So we could look at that and we could say, okay, his cadence was low, his step length was low. Okay, does he have adequate strength? So we're going to correlate back to another test, maybe manual muscle test strengthening. That does he have adequate strength to actually be able to walk and propel himself through with his ambulation, right? Is that something that is appropriate? Because if it is, then we can tell him to just take bigger step lengths. But if it's not, then we need to go back and we need to actually have him do more, let's say increase the cadence and the actual churning out of steps per minute, because that will allow him to then have a better recovery step if he does lose his balance moving forward. In the interim, you can then get him on a strengthening program that will help to reduce some of those miscellaneous musculoskeletal issues that he's experiencing, their pain, range of motion issues, or actual weakness, right? And so that's how you can start to look through the data from a clinical standpoint, and you can really get to the root of what's going on. And that, prior to this, a lot of this was observable gait patterns, which as clinicians, we are very good at seeing, but we can't get into the details of those measurements, and they're not repeatable, certainly, okay? And that's where we can get a lot of information from the system that can get the patient the care that they need more quickly, and allow them to move back into the whatever lifestyle they're wanting to get back into, but do that more quickly. So.
Well, Andy, appreciate that. It looks like we can do a screen share if you would like to walk through. But first, the overall goal here, what we're really trying to do, there's different ways to tackle risk. We don't call it fall prevention, right? But what we can do is reduce the risk of fall. So we call it fall risk reduction. And we really want people to be as happy and healthy as they can be for as long as possible.
Absolutely.
And so this is, there's different approaches to this. We are definitely looking at, we're not going to just rely on this as our only way to help reduce falls, but this is an amazing way because it's proactive. It's getting ahead of issues, and it's identifying these imbalances and giving us a path to, correct them before it becomes an issue. And if it's you or one of your loved ones who, is at greater risk of falls, once there is a fall that happens, hey, you could recover fine, but the older we get, the more of a chance that it's going to be something that will be debilitating, or at least, it won't give you the chance of, really being able to experience life to its fullest as time goes. So we want to give you the best chance, and so we want to be proactive about that. And in a minute after Andy's done here, we're going to talk about briefly how it could, potentially get some insurance benefits out of it, right? So it's not all out of pocket. So, but first, let's try this, Andy. All right.
Ooh, all
For
right.
that. So maybe if you could switch your screen.
Let's see if I can pull this. Can you guys see that?
All right. Yeah, that'll.
Okay.
There we go.
So this is something that I share with a lot of clinicians as we're actually running through data, but it's specifically this sheet here. And let me see if I can, because what I like to show people is what really does this mean from a like walking speed standpoint. We can see here that this is all literature, that this isn't virtue sense literature. This is literature research that's, derived from, CMS, different NHI type of studies, those types of things. And so as we look at some of this data and what it means, we can actually get people into the proper living sections based upon how their speed is. We can create less hospitalizations for individuals. We can actually determine when they need to have fall risks, okay, or actual fall risk interventions, okay, when they're capable of being more ambulatory, okay. So this helps, again, us as clinicians make quicker decisions and very precise decisions for the residents at the facility, so that they can get the need and the assistance that they need. There's all kinds of different data I could throw through here, which is kind of fun for me because I am a data geek. But I think the biggest one here is that CMS, which is Medicare themselves, has designated that just 0.08 meters per second in terms of change in gait speed can reduce fall risk. So if we can get individuals and be proactive, as Mark was saying, identifying those who are starting to slow down before something does actually happen, we can start to put them on the right path and get them moving more via wellness and through the actual therapy, one-on-one therapy. We can get them moving in the right direction more quickly. So yeah, that's the other thing I wanted to share there, Mark.
Great, thank you.
Mm-hmm.
Yeah, Billy, are you able to talk through what it looks like to get, how does someone qualify to use, Medicare or their other, insurance for the proactive services?
Sure. Yeah. So that's it's actually pretty easy. There are a number of options, especially now with telehealth coming out. But just reaching out and contacting your physician to tell them that you're interested in a screening. For Healthpro ourselves, we love our comprehensive health and wellness assessment. So you would just reach out to your physician, or you could come meet one of our therapists who can reach out to the physician for you to request a script to do the comprehensive health and wellness assessment or a balance screening, or if there's any other condition or topic that you'd like to be seen for, we can request that for you. Once that's completed, you can just provide that insurance information to our on-site therapy team, and we will run an insurance benefits review for you. So, if you have two insurances, sometimes that will completely cover it. If you're solely on Medicare, there's typically a 20% copayment. But each person's going to be a little bit different. So I would recommend, reaching out to your on-site team and getting them to run your specific insurance cards before starting therapy. That way, if there's any co-payments or anything along those lines.
Great. Well, up next, we'll demonstrate some of the games on there. But first, Billy, was there anything else you wanted to share with us before we cut back to Gunnar and Kristen?
I am just going to throw out again for my favorite comprehensive health and wellness assessment. We tie the two together, but just like Andy was talking about, and like you brought up as well, Mark, this device is great, but there are some other factors that correlate to an increased risk of falls, like the number of medications you're on, your past medical history, and things like that. So in conjunction with VirtueSense, we love to use that comprehensive health and wellness assessment to go over an entire range of things that might cause you to have a fall or an increased likelihood of getting injured, because we do want to prevent that. And we try to keep those screenings twice a year or more if you'd like. That way we can show if there's any changes in your other standardized tests or with VirtueSense. Sorry, I was reading notes. And just making sure that you guys are maintaining a healthy, active lifestyle.
All right. Well, thank you for that. And again, if anyone has questions for Billy later, we can cut back. But next up, let's see. Gunnar and Kristen, are you guys ready?
Sure thing.
All right.
You want to show off some of the games? These are some trainings we can do.
What we're looking at is the veggie slicer. So you can't really see it too well here, but Gunnar is using his hands to slice the vegetables. And let's see if we could switch and see it better. So you can see right there, you know, he's trying to hit the vegetables, but not hit some sponges. At the end, it's going to tell you a score. This is fun. I got to play this myself. It's good to, you know, as you can see, it's movement, and we like movement. It may not get the heart rate up a ton, but it's using different movements to, you know, really start to broaden your range of motion, and you know, it does help the blood pump. All right, so this is skiing. So you can see Gunnar doing some lateral movements here, just picking up on the ski slope as he goes down. Bending, you know, doing these games with our partners, Rise Senior Living, there to watch you. You know, if our resident or the user is going to be bending improperly, we have someone there to correct the bend. You know, you don't want the knees to go past the toes when you bend. But again, it's movement, so we like to see that as well. Okay, let me switch here so you can see it better. There we go. So video games aren't just for kids anymore. They're much more interactive these days. The difference between this and the Nintendo Wii that I remember, I haven't used it in several years. With the Wii, you have controllers that you're holding, and so the screen is using the controllers to kind of dictate your movements. In this case, it is picking up your actual body parts. For anyone who's done a bike fit with technology, not just your normal bike fit, again, with the coach's eye, which is still very valuable. But there are bike fits out there where you put dots on the different joints of your body, and so you can really hone in on, you know, where those movements are. So this does that without.
Okay, let's see if we can,
guys,
we can hear me. Maybe
this does that without the dots on your
so
joints.
let's see. Nice. Any more that you want to go over?
Well, I think at this point, let's see if there's some comments.
Okay.
All right, we did have one question of, you know, approximately what percentage of residents do we have that are getting physical therapy in Camellia Place? Which, you know, it's every community is different.
Yeah.
Ours is 50-50 assisted living and memory care.
Right now, I believe we have 13 on caseload. 4 or 5 in each house, most likely. And so I don't know how many that is in terms of full community. But there's like out of 16 beds in each house, you probably have 3 or 4 residents currently. And we have some that are off, maybe some that are also on home health right now, and then a couple are healthy fit, just our like activity exercise program.
Yep. And so what we do is, upon move-in, our resident gets an assessment up front, and then quarterly or upon change of condition. So, the fact that we are constantly looking and trying to be proactive about it is great. It's wonderful. As people have their assessments and they have successful outcomes, they can graduate on. They don't have to use it anymore. And then we can roll them into one of our physical exercise. Maybe it's group fitness or
Right.
Rise is also available for private training as well.
Yep. We have a couple right now on that private healthy exercise program, Healthy Fit.
Yep, great. Got another question here. So is this a perk of residency or is there an extra charge? So this is the assessment is a perk. It is a free assessment. And then as we were kind of talking about earlier, if there's a major issue, that's something that we can get taken care of by through insurance. Gunnar and Kristen can help.
Right.
What the VSTBalance that we're looking at today can also produce a report to support why we can get this pushed through insurance. So in those cases, it's just a matter of deductible. Or if things are generally pretty good, again, it's the first test is a benchmark. We know where they are when they come in. We can again put them through our free exercise classes, or if they wanted the extra help, then they would be out of pocket to get a personal trainer through Rise or your choice. But again, it's being proactive about it, and then we can track progress on a quarterly basis, so we can see what's working or where we need to change at that point.
Perfect.
Gunnar, did I miss anything?
That was it. Good job. You're just doing my job for me.
Yeah, having coached before, I get it.
Yeah.
So, all right. So I know you guys will probably have more questions for us later. We are here to answer questions. If anyone has questions about the community itself, we're going to redirect you to our community liaison. Her name is Lisa. Lisa is fantastic. She's
awesome.
Yeah, she's been there since the community was first opened about 5-6 years ago, and she's really a resource for everyone. So even if someone's not a fit for us, she can help guide you to the community that is a good fit. We are we like this technology. This is something also that, hey, if other communities in the area get it, it just benefits everyone. So to my knowledge, I think if we're not the first, we're one of in the area, and so we're proud to be rolling this out. All right, so I'm going to add back in Andy and Billy. So we got the full team here. If anyone has any other questions, now's the time. We'll give it a minute. And then in the meantime, I guess, final thoughts. Billy, we'll start with you.
It's a great resource for everybody, very quick, easy screening tools. And, our whole goal, especially over at Rise, and I know in your community too, Mark, is just keeping you safe, happy, and healthy for as long as possible. So, hopefully we get to work with you, and thanks for your time.
Great. Thank you. All right.
Yeah.
Andy, over to you.
Yeah. Just really piggybacking on what Billy said, it's a quick, easy assessment that is a free perk to get at least a baseline measurement to know where you're at. And then you can track yourself over time to make sure that you're maintaining where you're at, and so that you can stay living the quality life that you want to live. And for that standpoint, it is a huge value add to the community because it helps to create a overall healthier population within the community, which helps also decrease costs for the community senior members and all that sort of thing too. So there's a lot of added benefits to the system and to the usage of it. So I encourage people to go and get screened as much as possible, because it's not anything to be afraid of. It's just to get a baseline of where you're at so that you can measure yourself down the line. It's a measuring stick for down the line. So, yeah.
Thank you.
Mhm.
Well, Gunnar, Kristen, behind the camera there, if you guys have any closing thoughts.
No, we're good to go. Hopefully did a good job showing you what it can do, and then just come see me, come hang out.
Yep. We're a fun community. It's filled with people who really care and are looking out for you or your loved ones' best interests. And then Camellia Place has the full support of Empower Living. We're excited to be here and to be rolling this out. So thanks to everyone for participating, for watching. Feel free to leave questions in the comments afterwards, or reach out to us directly through the Facebook Messenger. Thanks, everybody.
Thank you.
Thanks a lot, guys.